So let me just start off. I'm going to talk to you for about 15-20 minutes about COVID, and then I will leave the floor open for any questions that can come from you. If there are too many participants joining, then we will probably have you type out the questions, or then you can, otherwise, you can ask me questions directly once I'm done with it. I'll be more than happy to answer any questions. So, to begin with, um, in our country there is a lot of hysteria that is going on right now about COVID. I would call it as mass hysteria, where people are very scared and very anxious, and they don't know what to do. Nobody seems to be having an answer to the COVID, neither do the doctors nor the government nor the WHO. So everybody is doing what they think is the right thing to do. Now, you must be seeing day in and day out a lot of WhatsApp messages, telling you how to be careful. I've seen recently one of those messages where one doctor is in her gown and she's crying and she's telling people that people are dying here, people are dying there. COVID is so dangerous. Even if you wear a mask, it is not useful. Even if you do social distancing, it's not useful. People are dying here, dying there, but you be careful. So my question is, how much more can you be careful? I know a lot of you would have been sitting at home for the last 1.5 year, not going out. Quite a few of you are going out also, but you would have still got COVID. So how much more can you be careful? So I am here not to scare you about COVID. I'm here to tell you something about COVID. So last 1.5 years, if I have disappeared from the clinic, it was basically because I got a call from the Ayush Ministry, and they have asked me if I can do something about COVID. And from then onwards, this journey started where I've been interacting with the Ayush Ministry, the AIMS people, and CCRH and stuff like that. And as on today, happy to say that we have treated 1,700 COVID patients and success. Me and my team have been on the job. We have treated more than 1,700 COVID patients and suspects. And we have doing the results are extremely good. And so that's one of the reasons why AIMS Bhopal has agreed to partner with me and conduct a clinical trial. Now, a clinical trial is very important to prove scientific validity of the results. So they have agreed to join with us, and we will hopefully next week we'll be starting the clinical trials at AIMS Bhopal. And we will be starting trials on severe cases of COVID who are in the ICU and who are on oxygen support. So we'll have the results coming in about a month's time. But as of now, we have already touched 1,700 patients. Now, see, the thing about COVID is, I feel that a lot of people are dying because of the fear and not because of the COVID. Now, let me explain to you why this is happening. I want all of you to know this because some of you are affected with COVID. Some of you will get COVID because now it is airborne and there is no way to stop it. Everybody knows there is no way to stop it. How much ever you do, whatever social distancing you do, mask you wear it at home, it's not going to happen. So let us stop asking ourselves, how do we stop COVID? Let us ask a question as to what do we do if we get COVID? That time is over where we say, what can we do to prevent from getting COVID? Let's say if we get COVID, what do we do? Let's be prepared for it rather than, suddenly it hits you, you don't know what to do. You are lost all over. You're having people telling you all kinds of opinions, and then you're totally lost. So that's one of the reasons I want you to be prepared if you get COVID. Now, contrary to this belief that COVID is killing people, let me substantiate, let me give you a few examples and tell you how people are dying out of fear. See, there's this lady who was 40 plus. She suddenly started breathless. Her husband took her to the first hospital. They said that her oxygen level is low. So they gave her oxygen and said, there's no bed here. You go to the next hospital. So she went to the next hospital. There they said, we don't have beds. Go to the next hospital. So she was in an ambulance. She went to the third hospital. There they said, your oxygen levels are low and you need oxygen. They gave her oxygen, but they didn't admit her. She went to the fourth hospital, and by the time she reached the fourth hospital, she died. Later, they came to know that she didn't even have COVID. She was just an asthmatic. There was a 70-year-old patient of mine who was COVID positive. He had only mild cough, and a little bit of fever. 4 days, he was okay. Then the doctor said, get yourself tested for D dimer. So they got a D dimer test. The D dimer was showing high. So the doctor said, you have to get yourself admitted. Now, the moment he heard that he has to get admitted, he started to get breathless. The children said, let's go. He said, I don't want to go to the hospital. He was pleading with them, I don't want to go to the hospital. But the children, out of goodwill, they took him to the hospital. Day two, he died. Now, you would have all heard about or read about two people who were standing in line just to know if they have COVID. And they collapsed and they died in the line. How is it even possible? You think COVID is something that it will go inside you and shoot and kill you? It doesn't happen that way. I'll explain to you what happens when you're in fear. I mean, I want you people only to imagine what happens. The moment we hear that we are COVID positive, however strong we are, we start to get anxious. Now, people who are 50 plus or people who have got BP and diabetes, they already know that if they get COVID, they are in the risk group, because the government has been telling them again and again and again. Everybody has been bombarding. If you are above 50, if you've got a BP, if you've got a diabetes, if you get COVID, you're done. So that's there in your mind already. So if you have any of these underlying conditions and if you're tested positive, however strong you are, you start getting worried. The moment you start getting worried and you start getting panicking, what happens is the body has this way of changing its breath. If you notice, when you're angry or when you're scared, you start to breathe faster. It's an unconscious thing. It happens subconsciously. So when you do that, carbon dioxide pools in the blood, in the lungs. Because you're trying to take in more of oxygen, you're not giving out carbon dioxide. So you suddenly start feeling a little breathless. The moment you start feeling breathless, the mind goes, okay, the COVID has affected my lungs. And then you start getting more and more anxious. Your breathing becomes harder. And then you lose your sense of mind. Then the next thing you want to do is, I want to go to a doctor. I want to get myself admitted. Then you go to the doctor, and the doctors now let me tell you something about these doctors who are treating COVID patients. You and me are only hearing about people who are dying. Day in and day out, seeing people die around them. Not just one or two, they are seeing multiple people who are dying around them. When you see death in such close quarters, you tend to get scared. Doctors are also human beings. Now they look at the people who are dying, they get worried, they get scared. So what do they do? The moment you come, you're COVID positive, okay, here are 16 medicines for you. One antiviral, one antiparasitic, one HCQ, one antibiotic, a steroid, an anti-allergen, and multiple different. There are some 16 medicines which are given to you at one shot. Remember, you don't have any symptoms. You're just COVID positive. Now, all of you would have at some time or the other seen that even if you take a simple antibiotic, you know how your stomach goes. You feel weak. Just imagine if you take 16 of these drugs at one go, your body is bound to react. So from without any symptoms, you go to a doctor because you're anxious. From there, he puts you on all those medicines. Then your condition starts to become bad. Then you start fever. Then you start loose motions. Then you start breathlessness, cough. And then you go from bad to worse. Trust me when I'm telling you this, I'm treating so many people who have been handled this way. Why did you go to the hospital? Did you have any complaint? No, I didn't have any complaint. Why did you go? Because I was COVID positive. What we need to realize is the statistics prove that 94% of the people, 100 may 94 people who get COVID do not need medication, do not need hospitalization. They can get better on their own or with simple medicines, homeopathy, Ayurveda, home remedies, paracetamol. Only the 6% needs medication. This is a statistics that is proved. But we are in such a mass hysteria that we are only looking at those 6% or the 2% people who are dying. We are not looking at the 94 people who have recovered. Now look at yourself. Ask around you. How many people know who have recovered from COVID in and around? So many people. So many people who had underlying conditions recovered. 90 plus people have recovered. People who are aged, who are 90 plus, they have recovered from COVID beautifully, without any problem, without any medication. But we don't look at it. I mean, this is human tendency. We don't look at all that. We only look at the 2% who are dying. Okay. Now you've heard of people who are dying suddenly. Arey, that fellow was there. No, he got COVID, and within few hours, that guy just died. Have you seen somebody die like that? No. You've heard of somebody die like that. One fellow in the entire country, 1.3, so many crores population, mein one fellow or two fellow died suddenly in 4 hours, but we will remember that. We will not remember the rest of them who have recovered. No, COVID is killing people. They'll suddenly die. So let's be careful. जिंदा है तो बाद में देख लेंगे side effects. Let me tell you this. Even if you recover from this COVID, we are going to have a whole generation of people who are going to be sick. We're going to have a lot of gastric issues. We're going to have osteoporosis. Or we're going to have eye issues because of the steroid use and all these medicines use. I'm not against these medicines, but I'm against these medicines when it is not required. You see, any allopathic doctor who is reasonably good, they will all tell you the same thing. You don't need, now the government is also saying stay at home. If you're asymptomatic, don't treat yourself. But the moment panic kicks in, whatever anybody says, it doesn't register in your mind. You just rush to. So this is one of the reasons why I'm having this meeting. So in simple terms, let me tell you what I would do if I am tested positive, or if I get any symptoms, so that I want you all to understand how it is. Now, the moment I start getting a cold, cough, or a little bit of fever, I have a doubt that I have COVID. I'm only doubting that I have a COVID, mind you this. But to be on the safe side, let's say I want to get myself tested. I will have to either go to a center or I'll have to call somebody home. Most of us will go to a center. Now, you all know that this virus is airborne. It is not now spreading by cough, it is airborne. You are right now only suspecting you have COVID. But if you go to the center, you will 100% get COVID. Even if you call a guy home, that fellow will have COVID all over him. His suit, his kit, his gloves. You know how our guys are, they don't dispose gloves just like that. They'll use it for 3-4 people for sure. So I would not go and get myself tested. I'm not interested to know if I have COVID. I have been through a cold, cough, fever all my life. Every change of season, I get this. And I would treat it exactly like that. Of course, I would isolate myself in a room because I don't want the others to catch it. And I would use simple homeopathic medicines, Ayurvedic medicines, home remedies. If I have fever, I would use crocin. If I have a lot of sneezing and all that, I might use a cetirizine. If I'm coughing badly, I will use our AQ liquid or I will use a cough syrup. I will stay at home. And I know for a fact that 94% of the times I'm going to be fine within a week, 10 days time with that medication. Now, when is it that you need to worry about? You're having unrelenting fever for more than a week. Your fever is not coming down for more than a week. You're coughing very, very badly. You're having a wheeze where you're able to hear a lot of phlegm. That, and you're not comfortable. That is when you seek medical help. Now, let me ask you all one thing. There are a lot of them who are 50 plus. In this 50 years of your existence, how did you ever know that you're sick? Your body will tell you. It has always told you. You've all come to me with some complaints. You've just not come to me and said, Dr. Manoj, I'm here. You find out what is wrong with you. No. You've come to me saying that my back is paining, my throat is paining, my head is paining, my shoulder is paining. I'm not feeling good here. I'm not feeling good there. So in this, so many years of your existence, your body has always told you what is wrong with it. And then you took care of it. I mean, that's how it works. Why is it that suddenly you stop trusting your body? Why is it that suddenly you feel, no, my body may not warn me and something can happen inside me and I'll just die? Just because you've heard that one person who is in some Timbuktu place who died suddenly? No. I'll also tell you why people are dying suddenly. I'll give you a logical explanation for it. So listen to your body. When, if your lung is getting severely damaged, you will be the first person to know. Trust me when I'm saying you this. It's not possible that your lung is getting damaged and you are nicely partying around and suddenly you drop dead. It doesn't happen. You will know by signs and symptoms that there is something wrong with you. That is when you take help. Now, the second mistake that people are doing is investigations. You're COVID positive. Now I want to get tested. You go and get tested, your D dimer, your C reactive protein, and CT scan. These are the three tests that is normally done. Your D dimer is showing high. You're worried, your doctor is worried. But the fact is, D dimer is not a COVID specific test. D dimer is always raised in any kind of infections and inflammations. A very, very, very high level of D dimer shows there is blood clot happening, not otherwise. Similarly, C reactive protein has nothing to do with COVID. It is an inflammatory marker or an infection marker. Even if you have a simple cold, your C reactive protein will go up. Third is CT scan. CT scan ground glass appearance will come in 80% of the people who have got COVID. Because COVID affects the lung tissue and it will cause inflammation. When you take a CT scan, you will see that there is inflammation in the CT scan. It does not matter. It doesn't mean your lung is finished. It doesn't mean you're going to die. It only means the lung is going through inflammation. It will sort itself out without any medication. A lot of people are getting themselves admitted because their D dimer is high, because their CT scan is showing this thing. That's the wrong thing to do. What are the doctors going to do the moment you're admitted? 16 medicines they'll give you. You go there nicely walking and you're finished there. Why? The last thing that is the most dangerous thing that is happening is oximeter. 32 years of my experience, I have never used an oximeter. Have I used on any one of you? Have I ever told you guys to use an oximeter? No. Because our oxygen levels are all the time going and coming down, depending upon our activities, physical activity, depending upon an emotional activity. After we eat, when we sleep, our oxygen levels can keep increasing, decreasing. Now, all of you know the popular yoga guru Ramdev Baba. The other day he showed on TV that he could reduce his oxygen level to 72 very, very comfortably without any discomfort. Within a few minutes, he could take it back to 99. That is how oxygen fluctuates in the body. It's not a disease. But you're COVID positive, first thing you buy is an oximeter, which is there with your finger 24 hours. Every 2 hourly, I get a message, doctor, my oxygen level is 95, mine is 90, mine is 89. Do you have any problem? No, I don't have any problem. Do you have a cough? No. Do you have fever? No. Do you have breathlessness? No. What's your problem? No, my oxygen level is showing so. Very few of them listen to me, trust me. Most of them don't listen to me because the mass hysteria is so much that they feel if the oxygen level is low, they're going to die. So they go get themselves admitted. Oxygen, they're waiting there to get you admitted. Provided you find a room, provided you find oxygen. And the moment this happens, your body goes into that anxiety, your carbon dioxide pulls in. Now, the body has got a reaction called as a freeze reaction. Now, suppose you are threatened by an enemy. Let's say an animal is attacking you and it's going to pounce on you. Your body goes into something called as a freeze mode. That's a natural defense mechanism of the body. In this freeze mode, apart from you being scared and panicky, what happens in the blood is the blood solidifies. It's a natural body's reaction. Why does that blood solidify? Because in case you are attacked, you don't bleed yourself to death. In the body. Now, in people who've got COVID and who are dying, they're dying of something called as a cytokine storm. All of you have heard about it. I'm sure all of you know more about COVID than I know. because that's the only thing we have all been doing for the last 1.5 years. We are all professional PhDs in COVID now. So something called as a cytokine storm. What is a cytokine storm? Cytokine storm is your blood is solidifying. And there are some enzymes which are elevated. Now let me get another example here. You all heard about people dying of snake bites. Now, 85% of this time when a snake bites you, it is called as a dry bite. It doesn't inject the poison because the snake doesn't want to waste its poison on something that is not useful. But people die. Because the moment you realize you are stuck by a snake, your fear, panic, it causes the blood to solidify. And people who are bitten by a snake also die of a cytokine storm, the same as people who are dying in COVID. Cytokine storm there, cytokine storm here. This is the reason I'm telling you, people are dying more of fear. Not because of COVID. COVID is just a virus. It is not equipped with some ammunition that, it can explode in your body and then everything can burst and you can die. No. We are doing this to ourselves. Let us say you don't believe me at all. Let us say you want to follow the mass who are telling you that COVID is very dangerous. Let us be careful. What are you achieving in that? Are you getting anything out of this fear rather than sitting yourself in the house waiting for COVID to come and waiting for death to come? Are you doing anything in this? No. Nothing positive is going to come out of that belief. Stop being scared. You cannot and you will not die because of COVID. Now, I am sharing multiple videos on YouTube. Every 2 to 3 days, I'm uploading on YouTube some video or the other telling you what to do, what not to do. There is a breath work which I have been advocating to everybody. You can go on to the YouTube after this and see that breath work. Breathing is one of the most commonly used technique in meditation. Because they say when you breathe, when you focus on your breath, your thoughts does not go here and there. So in case any of you end up in a hospital, I hope you don't, but in case any of you end up in a hospital, I want you to remember this breath work. I want you to remember the talk that I've had with you. Remember to breathe and concentrate on your breathing. The reason being very simple. There are two advantages of this breath. Number one, when you breathe, you are increasing the vibrations. Thereby, you are dislodging the mucus and you are keeping your lungs healthy. Number two, when you focus on the breath that you're doing, your thoughts will not wander. What is your thought when you go to the hospital? As you reach the hospital, will I come out of it? Will I die? What will happen to my family? Who will take care of my financial needs? Who will take care of my wife? These are the thoughts that are going to go. However sensible you are, trust me, you will get these thoughts. From the hospital, you go to an ICU, the thoughts will increasing. Okay, now I've come to the ICU. It is all over. I didn't tell my wife where that money is. Your wife is not there with you because you are in an isolation ward. You will be looking at the ceilings. You will be looking at nurses if you find nurses in the hospital. Nowadays, for the whole ward, you have one doctor and one nurse. That's the kind of situation. So you are only going to think negative. And if you think negative, you're not going to breathe. And you will eventually have a bad ending. So the moment you reach the hospital, the moment you get time, you start breathing. You start focusing on your breathing. When you focus on your breath, your thoughts will not go to this negativity. If your thoughts are going to negativity, that means you're not breathing well. Bring your focus back on your breath. Always remember, if you breathe to live, you will never die. Remember this if you ever end up in a hospital. Just breathe. You're going to be fine. And all these oxygen things that people are talking about, let me ask you very simple. You don't need rocket science to understand this. You can be alive as long as you're breathing. You all agree to that. It is only when you stop breathing that you die. Now, people with lung issues or people with advanced COVID, they have difficulty to breathe. That is the reason they are giving oxygen support. It is not keeping them alive. It is keeping them comfortable. But the moment oxygen is cut off, if there is a leak or if there is a decrease in hospital, people are dying. They're dying. How are they dying? They're able to breathe, no? They are only on oxygen support. They are not on ventilator. They are not undergoing a surgery. On a ventilator, it is artificial. You cut off oxygen, you'll die. But even people on oxygen support, they die because panic. In Nashik, there was a hospital where 25 people died because of oxygen leak. It was in a open ward. They saw the first fellow having difficulty to breathe, so his relative sat on top of him and gave him that chest. The second fellow thought, oh, something is wrong. Okay, I'm also feeling breathless. That's it. Everybody started feeling breathless. You won't believe it. 5 people out of those who died were supposed to be discharged that day. I'm only trying to impress on you how fear is killing people. So do not panic. Nothing will happen to you. This is the only way we can get rid of COVID. We cannot get rid of COVID. We can get rid of the fear of COVID and we can stay alive. And this is the only way. Now, I'm not saying, throw your caution and then just get out there and party and all that. No, I'm not saying that. I'm saying don't be worried. You will be fine. Trust in the immunity that has taken care of you all these years. It is the government's or the social media which is causing this mass hysteria. They are going on telling about people who are old and people who are underlying conditions are going to die. So all this generation of people who are 50 plus and underlying condition, they've already got it in their mind. If I get COVID, I'll die. Get out of that. Look around you. Look at so many people who have recovered from COVID. Now, smart fellows have come up with another statement. The third wave is going to hit children. I've already started getting calls. How can I protect my child? Who the hell are they to say that children are going to get affected? There's some God or what? How do they know that children are going to get affected? They're psyching it out. Now all the kids are going to, the mothers are going to tell her, next wave is coming, be careful, it is going to affect the children. That poor fellow will be worried. His mother cannot lie to him, right? All the children are going to be scared. The moment you're scared, your immunity drops. You will catch the infection. So don't fall for these kind of things. Trust me, I've not been getting a paper at home. I've not been listening to the news. I only read things which are necessary for my research. Otherwise, I'm not listening to any of this crap. Suddenly you find aspidosperma, magic medicines, it will increase oxygen. It's a WhatsApp miracle. Aspidosperma, the homeopathic medicine, is good. It's used. It is there in one of our combination, but it cannot cause a magic. It cannot do magic. Magic is within us. We have to treat ourselves. We have to cure ourselves. So I will stop my talk right now, and then I will take questions. I think there are quite a few people. It will be nice if you can type and leave your questions. I'll be more than happy to answer them. And all of you, please go on to the YouTube link that has been sent and the Insta link that has been sent. Please, subscribe to it so that you will get the latest. I'm going on sending informations about the COVID, about how to handle the COVID and everything. Please subscribe to it today itself so that, you will get a lot of information from me coming in. Now, I hope what I have spoken made sense to you and gave you a sense of a relief in terms of not being scared. You're most welcome to write to me, and then we can start off with, I can take some questions. You need to unmute before you ask the questions. You can ask any kind of questions, most welcome.
Good afternoon, Dr. Manoj. This is Lynette.
Hi, Lynette.
Hi,
nice to hear
good to
you.
see you. Yeah, good to see you, and a very good session. Thank you for this, because I think more than anything else, we need the reassurance and the belief that we can definitely wade through this. I have a question, and perhaps I may have contacted you earlier on this, but just for probably some
You're
insight.
breaking, Lynette.
Can you hear me?
Breaking, sorry.
Okay, can you hear me now?
Now we can hear.
Okay. Yeah, so obviously we've been taking the immunity drops, and obviously the very common precautions that we take. We've been doing all of that. Um, the question of vaccination, obviously, vaccination, as far as our understanding, it helps develop antibodies. But the whole focus on immunity drops is essentially to strengthen our immunity system so that from within our bodies we are able to, manage any sort of viral infections and all of them. Longer term, what is more beneficial in terms of being able to combat or tackle these viral infections? Is that immune system, or are vaccinations the be all and end all of being able to tackle all of these?
All right. I understand there are two questions from this. Number one is about the immunity. So let
Mm.
me tell you this. Right from 1.5 years, people who have been taking the immunity medicines, I mean, there are quite a few of you also in this group who have been taking immunity. A
Yes.
lot of them have not got COVID. And a
Mm-hmm.
few of them who have got COVID either have got no symptoms or very few symptoms, and they have recovered within a week to 10 days without any kind of medication.
Mm-hmm.
Now, I have updated the immunity protocol now because of the explosion now. So now the thing that I am expecting out of the immunity drops is not that you don't get it, you will get it because it's so much in the air. But even if you get it, it should not affect you at all. You should be able to come out of it like a normal cold and cough that you would have experienced every year.
Mm-hmm.
Now, in the long term, it is definitely the immunity and the mental caliber that is going to help you.
Mm-hmm.
I would want to make a statement here saying that yes, COVID is taking away a lot of people. I'm sure a lot of dear near ones we have lost. But I am very sure that COVID is going to take away a whole generation of people who are weak, but
Mm-hmm.
not the ones who are physically weak. They are the ones who are mentally weak that who are going to go away, not the physically weak. Trust me, it's taking people away.
Mm-hmm.
Now, the second part of the question coming to vaccine. My take on the vaccine, you see, whenever we gave vaccine to our children or we took vaccine in the past, we just went, took it, end of story. All we would get is one fever or a little bit of pain here. But now, when you go on to take the vaccine, will the vaccine work? Will I get a blood clot? Will I die the next day? Will I have long term side effects? Which vaccine is better? So many questions. Now,
Yeah.
medicine and doctors is all about trust.
Mm.
If you're going to take a vaccine with so many doubts, it's not going to work. If you
Mm-hmm.
have to take the vaccine, go take the vaccine. Do not research about it. Do not think about it. Do not question. Take it and be done with it.
Sure. Yeah, it makes a lot of sense actually, because we are all trapped in the speculation around vaccines. Yeah,
True to that.
great.
Hi,
Thank you.
doctor. I have a question. I am Sujata.
Yes, Sujata, please tell
Hi,
me.
doctor.
Hello.
I got symptoms at the beginning. Then I started using your medication. With all that medication, I was feeling well, but I still have some worry that I might develop a few more complications and all. And then, till then, I was very normal with all your medications, and I was doing all my works very easily. But out of family pressure and all, I went to test myself for COVID, and then I found it is positive. Then I got really panicked, like anything that you were telling before. Just like that happened to me. I went very breathless, and now my doubt is, do I have to start using these steroids, as I started taking azithromycin and normal Ginkgo tablets, and regularly they are giving the course of medication, but I have not started the steroids yet.
Sujata,
I
if you
was
if you're able to talk so much, that means your lungs are damn good. Okay.
okay,
I
okay,
don't have a problem with allergy or something. My problem is with steroids, antiviral, antifungal. These are the
okay.
ones which are ruining you. You do not seem to have any kind of a problem. The only reason you want to go for steroid is because you're panicking. because somebody told you that if you don't take steroids, and what can
Yeah,
happen? You look so
I was
healthy and
told
you
that
talk.
that virus will stick on to lungs, and in future it may cause some problems like clotting and all.
In
So when
future, the steroid, if you take, you know what will happen? You will develop diabetes. You will develop osteoporosis where your knees and this thing will go. Your kidneys might get affected. You're not bothered about that. But you're bothered about a virus which might affect you in the future. No, that's not true.
okay,
If you are taking homeopathy and you are getting better, nothing, no long term side effects will be there for you. I can assure you that. But if you take a lot of antiviral and anti-fungus and all that, then I would suggest you take medicines to improve your immunity for the next 3 months' time, because it would have definitely ruined your system. I
okay.
mean, in your
And
place,
one
yeah, in
one
your
more thing.
place,
My mother is a chemotherapy patient. She was also affected with COVID,
huh,
and I'm using these pills you're giving, the drops, viral drops and all. But I have started. We took the CT scan, and the CORAD number is 4, uh, 5, 5, so 5. And so we got panicked, and we were rushed my mother to hospital, uh, and we went to railway hospital. Actually, they told her breathing is normal and no saturation, so no need to admit her in. She's not she's not in emergency now, so we got her back. So my doubt is, do I have to do anything, as the CORAD value is 5? Do I have to take?
yeah, I
She is a
understand your question.
chemotherapy patient.
I understand your question, but this is what I told you in the beginning. Why do you want to take her to the hospital? Because your CT scan is showing. Take her to the hospital if she's got a problem. Now, you yourself said when you went there, although she had a CORAD 5, the doctor said there is nothing wrong with her. That itself proves that the CT's value do not mean anything.
Okay.
Listen to your body. Your body will tell you when it needs help. Only and only when it needs help, then take her to the hospital. Otherwise, do not take her to the hospital. And trust me, if you take her to the hospital and admit her with a chemotherapy patient, less chances of her coming back. She's got more chances of staying alive at home.
Okay. Only the panic is creating issues, doctor. Till then, I was okay when your team told it's okay, you have COVID. Then also, I didn't react. When I found myself positive, then I went like panicking like anything.
Exactly. This is the classic case of what I've been talking about. I mean, everybody is reacting like it is not just you, Sujata, but everybody is reacting like this, unfortunately, and they are all not doing the right thing.
Yeah. However, we are trying. I'm trying to be stable, but some family members will come and ask, "Are you taking these medications? Are you taking? Or have you not started anything yet?" Then I start worrying again.
So
Maybe
you
I'm
people,
not going in correct way.
I think we have a few people here. I think Geeta is there. Geeta has gone through COVID, and her family and she went through COVID. Her husband also went through COVID. They've been bombarded by people, like you're saying, take this, take this. At least now you guys don't bombard people, because I've told you so much. You guys, when you hear that something is wrong, you need to go and reassure them that nothing is going to happen to you. Trust me when I tell you this, people have more chance of surviving at home than in the hospital. It is our duty to give confidence to them that nothing is going to happen to you.
Okay.
In fact,
Yeah. Yeah, Geeta, go ahead, please.
In fact, I wanted to share this. Like, we have just come out of COVID, and trust me, we haven't taken any other medication. Although my husband's oxygen level, as Dr. Manoj knows, it was below 88. His fever was fluctuating up to 103, and he had very bad congestion. And as Ms. Sujata said, that people in our relatives were bombarding with why are we not going for allopathic? But we just stuck to homeopathic and we believe Dr. Manoj, and today we are all out of it. In fact, my husband is doing absolutely fine.
So there are many people who have been in the ICU and we've been giving them blood drops and they've gotten better. 70% lung damage, people have come out of it. There are many people who have gotten better. So we don't need those kind of aggressive treatment to combat COVID.
And one more doubt, doctor. If the CT scan is showing CORAD value 5, will the lungs will come to normal state again?
100%, 100% it will come back to normalcy. Even if it is showing very high values, the lungs always come back to normalcy. You should not mess it up by taking medication. That's the biggest problem.
Good evening, doctor. It was very reassuring listening to you talk, doctor. And actually, we just want to know, we've just started with your immunity drops. So is it necessary to go in for vaccination?
So like
or this is sufficient?
Yeah, I can give you a simple answer, ma.
Doctor,
yeah, go ahead, please go ahead.
This is Jacqueline. No, I forgot to introduce myself. This is Jacqueline, and this is Sundar,
That's fine. Good
so,
evening.
is it necessary that we should go in for vaccination, doctor?
Me and my family have not taken vaccination. I'll give you the reason. For the last 1.5 years, I've been on immunity pills and I've been traveling a lot. I've been traveling to Delhi, I've been traveling to Bhopal. Multiple times I've been traveling because of the COVID related work. I've been going to AIMS Bhopal, AIMS COVID wards I've been going. So far, touchwood, I have not got COVID. I have older people in the house who are 80 plus. They have not taken vaccines. They've been on our medicine so far. They've also been doing everything. They have not got COVID. Now, I believe that if it can take care of me for 1.5 years, it can take care of me for a while longer. And my thing is that in another 6 months time, they will come out with a better vaccine, which is hopefully proven better. And, it will cover all the strains and it will have less side effects also. So I'm waiting for that. Now, let me give you another perspective of the vaccine if you all don't. Still date, the vaccination has covered only about 10 to 12% of the Indian population. 10 to 12%. It is supposed to cover 70% for us to get herd immunity. To reach 70%, we will take 2 to 3 years. By the time we reach about 20% vaccination, the first lot who have taken will have to go for the second shot because vaccine is effective only for 1 year. So statistically, that vaccine drive will never be completed. But having said that, if you feel safe taking a vaccine, go and take it and continue the immunity also. Don't worry about the vaccine side effects and all that. Just go ahead and take it.
Doctor, one more question. How long do we take the immunity drops? 2 months, 3 months?
See, the answer is very clear. As long as the virus is virulent, which I expect to be next 3 to 4 months time, continue till then. Once the viral load comes down, once the scare is gone, then you can slowly taper it off.
Okay, doctor.
Doctor, I have my sister and brother in the US and Canada. Is it possible to send the medicine across to them, doctor?
Yeah. The courier service is available. You call up the clinic, they'll be able to do that. Not a problem.
Okay.
And one more thing, doctor, if a person has been vaccinated already, first shot is given, after taking the immunity drops, should they go in for the second shot or they can just leave it that way?
No. They should go for the second shot. This is a protocol. You must follow the protocol.
Thank you very much, doctor.
Is there anything else we can do apart from the immunity drops, doctor?
Stay positive. Be bold. Don't be scared. Don't panic. Enjoy your life.
Thank you very much, doctor.
Continue to do what you were doing all these years. Have your drink in the evening. Enjoy yourself. Watch your serial. Do what you want. Don't be scared. You'll be fine.
Right.
Thank you very much, doctor.
Thank you so much, doctor.
Thank you very much. God bless you.
Hi, Dr. Manoj.
Hello.
I'm Ramya. So I came to you while I was very little and I'm coming back to you again. So basically I got COVID. I think we spoke over the phone probably like 5 days ago or something. I messed up a lot of things because I took loads and loads of tablets during my COVID recovery period, including the great steroid. And I've been suffering for quite some time now with a lot of things, but thankfully with your support and the drops that came home, I'm feeling a lot better. I'll continue to gauge up in my health also. I hope so at least. But every now and then this whole thing of panic strikes because though I avoid social media, no paper, nothing, you get phone calls of people asking you for help to arrange a bed or an oxygen, or suddenly something happens to someone and things like that. So it feels very helpless sometimes, and somewhere that fear creeps in ki, oh, okay, so we don't know what else is a symptom post COVID or during COVID. So what if something happens to my family? So I've been so sleepless. I wake up in the middle of the night, watch my mother, watch my husband. I ensure that they're breathing again, go back to sleep, you know. So I know I'm very crazy by saying this, but then, yeah, that's happening to me. So I'm trying to keep myself sane. I know that I'm being supported with a lot of very good homeopathic medicines, and I know all of it, but still I'm not able to help this panic. What do I do?
Yeah, so Priyanka, Ramya, what you're going through is something that every one of us are going through. You're not unique in this. Trust me when you say that. You're open with this, but this fear is there in everybody. I mean, ask people who have gone through it. I mean, Geeta is here. I'm sure she would have gone and checked on her husband 2 to 3 times in the night. I mean, we would have done this to our kids, when they were very small, toddler. You would wake up in the night and suddenly see if they are breathing. This is natural, and there's nothing wrong in it. But let me reassure you of one thing. There are very, very few people who've got COVID for the second time. Okay. So once you've got COVID, you do develop antibodies, and the chances of you getting COVID the second time are very, very bleak. I want you to believe that you will not get COVID again and be bold. Do what you want for others. Go and help others. Expose yourself. Nothing will happen. If it happens, I'm there for you. So be bold.
Done.
Number two, people who have taken these steroids and people who have taken multiple medicines for recovering from COVID, I would strongly suggest you contact the clinic and then start on an immunity building, because there are long-term side effects which are bound to happen, and nobody is bothered about those bound. They only want to save you from COVID. So they've dumped you with a lot of medication. You need to repair yourself for the next 2 to 3 months by taking enough medicines to protect your kidneys, to protect your bones, to protect your diabetes. There are multiple issues that can come out of these things. So it can be handled. I'm not blaming, that I've gone, I had to give in to pressure. A lot of people who are giving into pressure, and it's perfectly fine. This is the mass hysteria, but this can be taken care of by people who have recovered from COVID.
Yes, I'm currently on your post-COVID treatment and I feel a lot better actually. But any new symptom that comes up, I'm kind of torturing your team of doctors also, saying, okay, this thing is very new today. It came up to me. But they're very
You
patient.
won't get COVID again, Ramya. Don't worry about that. You will not get COVID. There are hardly. Have you ever read in the newspaper that so many people have got COVID again second time? Has this news ever come out?
No, not really. It's not about COVID, but because what could happen because of the load of medicines that I've taken. So that's the worry currently.
Let me explain this. All of you are hearing about this black fungus that is now affecting everybody. Okay. Now it's all blamed on COVID. COVID is causing black fungus. How can COVID cause black fungus? No. It is very clearly given in the literature. You Google and see side effects of steroid. You will see fungus as one of the side effects of steroid. The black fungus that is roaming around is purely because of the treatment and fungus, nothing to do with COVID. But who is going to say that in the open?
Actually, I feared that only. I read a lot of news articles and all. I was petrified, like literally petrified, because I was so scared. A doctor suggested me to do a brain CT because I also had like a mild swelling, light blurring of eyes, then ear pain, then headache and all. I'm like, oh shit, I have all these symptoms. I should do something. So that's why when I said I messed up with medicines,
don't worry about it. The reason the doctor told you to do a scan is because that doctor is also scared. I'm not blaming him. Because none of these doctors, all of them are scared. I mean, it's very understandable. It's quite understandable.
Thank you so very much. I got a good opportunity to talk to you after a long time. Thank
welcome.
you.
Dr. Manoj?
Yeah, Sanjay.
Yeah, actually, I think I will be aware because me, Anand, and my daughter, we three had this COVID in December. It was very mild, but since I was having that COVID preventive pills also, so after that it happened. So immediately, that immediately we contacted the Apollo and online all consultation, and by within 7-8 days, we were 10-14 days after quarantine, we were all on the toes. And the thing is that then I consulted Srinivas Bhai and all for the post-COVID for me, because anyway I take your medicines. So now when I'm having that post-COVID medicines, but I don't know, should I mention about that I don't know whether I had been given steroid. I don't think so because ours was very mild. I think thanks to your medication and everything. And uh, I didn't feel any, I mean, it's only that 14 days and little weakness. That's all. Nothing, no, nothing. So should I mention again? Because now already I have got the medicine, I think 2 days,
No,
2 to 3 days.
no, Sanjukta. There is a protocol which is given for post-COVID patients. So that covers
Post-COVID.
all side effects.
Okay.
It doesn't matter.
Okay, fine, fine. Okay, fine, fine. Thank you so much. And Ramya, yeah, hi. You have come actually to the best place, I will tell you, because I can visualize my situation. When I had come to Dr. Manoj 13 to 14 years back. Where every apprehension of mine, he was the person who used to always tell what happened, nothing, who dies like this, who dies like this. Every small problems, I used to be petrified and I used to go and meet him. And talking to him only used to boost up my immunity.
Actually,
so
very particular with the
exactly.
To talk
Fully. Now 1 year we couldn't meet him. That is a different issue altogether. But anyway, the support staff are awesome. Dr. Aparna and everyone. So we are all in touch with them only. So thank you so much, Dr. Manoj.
You're welcome. It's all about being positive. That's about it. I mean.
Yeah. Now we have.
I want to say something. Actually, doctor, to everybody here, Dr. Manoj was like my childhood hero. Yeah, good hair and smiling and so positive all the time.
Am I supposed to be old now, Ramya? Have I grown to look like a grandfather now?
No, you still
Is that what you're trying to tell?
To my eyes. You still look fantastically ravishing to my eyes. I wish I could meet you in person. I've been waiting. Yes, I'm going to run and come.
So sweet.
Doctor, I just wanted to thank you because it's a very reassuring kind of talk and a very necessary one. You've also addressed something that has been plaguing my mind because whatever, I've done a lot of reading about all this. I went through some virology courses on the net. And what I understood is that the current narrative that goes around is, totally baseless. And there's a lot of misinformation that's going around. And based on that, I felt that, this vaccine doesn't make sense to me. It just doesn't make sense. It will probably do more harm than do any good. And I feel that the immunity drops, whatever you're giving, I have, as it is, I have tremendous faith in you over the last 18 years. That apart, I think it's been very useful. So that is one clarification that is really helping because there's a lot of pressure, doctor. I think what is happening is people don't read, understand. They just pick up something from WhatsApp and just go on, talking about it without understanding, what is what. So every second person asks, when are you getting the vaccine? When are you getting the vaccine? And, with some people, you can always explain things out. Most people won't even understand.
Yeah. Thank you, Vinod. See, I only have one thing to say to everybody. You will have a lot of people giving you information, but unfortunately, the whole country is going through mass hysteria. So even the most logical person can give you bullshit information. But when you listen to this, I want you to logically think about it. What makes sense to you? Don't listen to what Dr. Manoj says or Dr. So-and-so says. Now is a time when you cannot depend on a lot of people because they are out of their mind. Their minds are not working properly. Use your intelligence. See what makes sense to you. Unfortunately, there was a time when you could depend upon doctors' advice and blindly follow it. But sorry to say, this is not the time because they are also very, very stressed and very, very afraid. You do what you think is right. What makes sense to you is what you need to do.
Yeah, I did decide actually eventually that I'm not going to get into the vaccine team because in any case, the government says it's voluntary. So if it is voluntary, then there's no reason why I should go voluntarily do something which seems stupid.
Correct. Makes sense.
So that I think this particular Zoom meeting, it sort of helped me because I was thinking all this all alone by myself. So I get your point of view.
I mean, my views are all over on the YouTube. We know there are quite a lot of YouTubes which have been, and even now Insta is also, I'm going on giving it out. So please make use of those views and spread the news around.
Thank you, doctor.
Doctor, I have one more question. When someone in the house is tested positive, how can remaining others like negative persons can be taken care of when we are staying in the same house?
See, if it was about 6 months back, my answer would have been different. My answer would have been be careful, isolate yourself, and all that. But today, if there is one person who is affected in the house, everybody in the house will get COVID. Whatever you do, simple logic. How do you know that you've got it? Some symptom will be there, some cold or cough will be there. That is when you realize that you've got something. Okay, let me go and check. So, one more day, 2 days, by the time you realize that you're COVID positive. In those 2 days, you're already mingling with the people in the house. So, they will definitely get it. So don't bother about isolation. Don't do anything. Just stay at home. Treat yourself. Everything will be fine. This isolation is all rubbish. You lock yourself in one room. The entire house you are roaming around. You think they
Because
will not get.
elders are there at home, I need to attend
They will
elders.
get. How will you take care of them? Tell me. You have to give them food.
Yeah.
When you give them food, the
And
virus can run.
I'm getting a lot of doubts. Can I give this plate of food to others? Will it
So
infect
all
them?
these doubts that you have, there is no answer to this. Rather than that, just give it to them. Be fine with them. Be normal with them. Don't scare them. Remove the fear of older people. See, I think all of you should do that. People, you got older people at home, you tell them that it is not true that older people will die when you get COVID. They can't hide themselves. In how long will they going to die? This damn thing is not going to end anytime soon.
Actually, they are very stable, but I am making them nervous by asking, "Do you have cough? Do you have fever?" Every time I'm asking them, "Do you have any symptoms?"
Don't do the same thing with your kids. I just told you.
Yeah,
You're going to
yeah.
go and tell your kids, don't go out, don't do that, because next wave is going to hit you people. No, don't do that. That's the wrong thing that you're doing. Try and be as normal as possible. If anything happens, get in touch with us. We will take care of you. Don't
Thank
panic.
you.
As long
Thank
as
you.
you don't panic,
I would
I
like
can
to
make sure
thank
that
Dr. Swapna on this platform.
she's
She is
here
supporting us like anything. I
and
have to
she's here.
thank her.
Without her and my
I'm
other team, I wouldn't have been
every
able to
now
do
and then
anything.
I'm calling her. I'm keeping all my panic on her, but she's giving a lot of support. Thanks to you all.
You know,
Doc.
you should know this. You should know this, that her daughter was also tested positive.
Yeah.
And she didn't do anything. She didn't panic. She didn't rush to the hospital. She didn't give us steroids. She just took to her medicines. And all our doctors, all our doctors who got positive, I'm sure there is Dr. Srinivas here. Nobody did anything except the homeopathic medicines. They didn't take any other medication. And they all got better. He's here. Srinivas Chakravarti is there. So he was positive. Now he's negative now. Srinivas, would you like to say anything? He's our colleague.
So I was tested 2 weeks back with the COVID positive actually. So what I have taken is only the homeopathic medicine what we follow for the patients what we do. I just taken that thing. That's it. Once in a time I have taken the paracetamol, and I was absolutely doing fine.
I get call from a lot of people that they are in the ICU. They are struggling. Doctors are saying they are going to die. I asked them, why did you go to the hospital? Because I was positive. Did you have any problem? No. No, my D dimer was high. My CT scan showed so much. So I went to the hospital. Most of the people have gone without any symptoms to the hospital and they are unnecessarily dying. I'm sure the doctors will come for my throat when I'm making this statement. But think about it. You also think about it. Does it make sense or doesn't make sense? I've seen 1,700 patients I've seen, and all of them are doing well.
Sir, can I come in for a minute, sir?
Yeah, sir.
Yeah, Sujata Garu, I've been good to see you in this meeting because we are in constant, we are in touch every day, and we have been talking every day and telling you what to do, what not to do. Of course, I can understand the concern and panic that you have. I would like to share my experience. My daughter, when my daughter went through COVID, because as Dr. Manoj has said, people are scared that next wave is going to hit children, and there is a lot of psychosis that's going on around. So I'll tell you what I did when my daughter tested positive for COVID. As everybody else, she started cough, coughing, having a bit of cold and all. Third day when she told me, but those 2 days I didn't isolate her because I thought it's just a common cold and cough, that seasonal thing that she generally gets. So she was moving around. Then third day, she told me she lost her sense of smell, and that's when I realized, oh, it's COVID. So I didn't tell her that, I didn't panic and tell her, so go and isolate yourself in a room. I told her, okay, now we'll have to be a bit careful. Just go and stay in your room. But I was going to her, talking to her. I was giving her food and all. I was taking care. I was giving her medicines. And, as being a daughter of a homeopath, she is not used to taking any allopathic medicines from her childhood. She is 16 years now. So I mean, I hardly gave her in her entire 16 years life. I think I've given her an antibiotic only once till now. So she's not used to taking a lot of tablets and also. She was just on homeopathic medicines and some vitamins. I was telling her to do steaming and all, and on 6th day she was all fine. So even if somebody tells you it's going to hit your children or something, just don't get panicked about it, as Dr. Manoj has said. And with simple medication and people recover. See, children have very good immunity. If we don't spoil it by giving it medicines and all, they are going to recover beautifully compared to we elders or we adults. So just keep cool, and as we are, I mean, we are there to guide you whenever you need us. Any time of the day you can just contact us for the immunity medicines, for the COVID medicines, or for the post COVID medicines. Yeah, so this is
Thank
this
you
is
very
my
much, ma'am.
experience with
Thank you.
COVID.
Thank you
Yeah.
very much. And one more point is, my son is getting very panic and he's not coming towards us. Since we have tested positive, he's isolating himself in room and he's not sleeping also at night.
See,
How
that's
can
very
I overcome this?
yeah.
I'm not able to understand.
That's very unfortunate that kids are also so scared and paranoia.
He's
What are
not
they
at
going
all
to
sleeping, doctor. He's
I understand.
he's telling he's worried.
Yeah, but he's
He's
carrying your
12
fears.
years old. He's 12
You
years
need
old.
to understand he is expressing your fears. They are not his fears.
Yeah.
You have transferred those fears onto him. You need to undo those fears by being normal yourself. That's the only way you can get him out of
He's
it.
not
That's,
allowing me to come near him.
yeah,
He's
that's
asking me
because
to stay away,
that's
and
because
he's
of the
getting worried.
yeah. You need to get that fear out of him. Just imagine when he grows up with such kind of a fear, he's going to be very bad. So you have to first change in order to change him. He is expressing your fears. It is not his fears.
Yes, sir. Thank you
Uh,
very much, doctor. This
Srilata,
session
I
is
think
very
you just
helpful.
thank you so much. Anybody else or somebody is asking about diet restrictions. There are no diet restrictions for COVID and all that. Eat, drink, make merry, be happy. Anything that gives you happiness, keep yourself happy. Your immunity will be at the topmost.
In
Keep
fact,
yourself
when we were
scared.
hit,
What, Gita?
in fact, when we were hit by COVID, you won't believe we also had biryani. Outside biryani also we had. So it's like,
Glad
and
to do.
I would like to say, Dr. Manoj, the very sentence of yours that I will take care, that itself give us all of us very, very
Exactly.
confidence.
I'll still take care of all of
We
you.
started coming to you.
Yes.
We have not been seeing any other doctor from the time we have come to you. Like when my son
Exactly.
was small,
Yeah,
any small thing happens, is they call up Dr. Manoj.
doctor, I am Vinita from Chennai.
Yeah, Vinita.
I have written the question also. I wanted to know what are the side effects. You have been talking about the side effects of vaccine. What are the side effects of vaccine? You mean short-term side effects like fever or something, or does it, according to you, have long-term?
No, the short-term side effects like fever, body pains, and all that. Okay, we don't even care about all those things. But this particular vaccine is supposed to be causing clots, which is one of the major concern that has been raised. Number two, see, what you need to realize is a vaccine usually takes about 5 years to 8 years to make. That is
Okay.
when you know for sure the long-term, short-term side effects and all that. We've had a vaccine which has come in 6 months.
Okay,
So
fine.
nobody knows what it holds for us in the future. But let's not go down that road, because today's scenario, you have to take vaccines, so might as well not think about it. Just take it. We'll cross the bridge when we come to it.
Yeah, how we will know about the clot? Because I have finished my 2 doses of vaccine. And
You will probably know in about a week's time about the clot itself. So that is why we have recommended Arnica 200 to be taken every time you take a vaccine for about a week's time. In fact, that is there in the video which was shared on YouTube. So Arnica 200 on the day of the shot, first and the second jab you take it, it will prevent clots.
And
But if it comes, it will come within a week's time.
my daughter is 27. So is it recommended to go, because they have opened for the kids also, like 18 plus also now they can go. I do not know really. We have taken the vaccine. So still we have so many doubts about it. In spite of all the doubts, we have taken it. Covishield, and people are saying go for Covaxin, Covishield. There's so much of confusion around. So should we wait for the better vaccine as you are telling and go with your immunity drops in between? I don't know.
So point number one, I'm still sticking to the fact that if you have to take the vaccine, go ahead and take it. Don't inquire about it. Don't find out about it. But having said that, if your daughter is young,
any
if your daughter is
vaccine, any.
No, I don't know. Don't find out which is good, which is bad, which is bad. Don't do that. But if your daughter is only 20 plus, most of these youngsters, nothing will happen with COVID, even if they get it. So I won't, unless there is some travel, thing that is required that you need to give her a vaccine for some university or to travel abroad and all that. Otherwise, I would say hang on. Wait for a better vaccine to come.
So in between, we can take your immunity.
Absolutely, the immunity drops are more than enough. They will protect you. Even if you get COVID, you will have a very mild COVID. We can get you out of it in no time.
Dr. Manoj?
Ama.
Yeah, but now of late, there's too much of, focus on the young generation, right? So that they should get vaccinated. As usual. So, should we take with a pinch of salt? We can wait, because anyway, Aditya, I sent the medicine to him also in Bangalore. So he's under that pre-COVID medicines line. So should we, anyway, he's not getting the slot also for the Covishield and all. He's 27, just like her.
Sanjukta, see, I'll tell you one thing. Like I said, as on today, only 12% of the Indian population have been vaccinated. There are so many of them that needs to be vaccinated. Only the rich and the people who can afford right now will get vaccinated. 70% of the Indians who are poor and who are in the rural areas. All right. So it is not that you take a vaccine and then you are protected. There are multiple millions of people, or thousands of people who have got COVID after being vaccinated, people who have died after the second dose of vaccines also. So don't bet on the vaccines, but if you feel strongly about taking the vaccine, if you strongly about giving your child a vaccine, go ahead and give it.
Doctor, one more question. Actually, I just want to know if you are available for teleconsultation. You've been busy all this long, like last 1.5 years. So are you available for teleconsultation, doctor?
So what we are doing is we've got now almost 10 doctors who are working for us. Everybody who takes the case, they've all been trained. Once the case is taken, the case sheet comes to me. I spend a lot of time looking at each and every case sheet and prescribing the medicines. Trust me, all the symptoms that are taken are seen by me, and then I give the medication. Personally, right now, I'm focusing on people who have got COVID because they are the ones who need me more than anybody else. They need a lot of support, both emotional support, medical support, telling them what is the right thing to do. I get calls at odd times, messages at odd times, because trust me when I'm doing this, like if what I've done for Geeta and her family, I have taken the risk of telling them not to go to the hospital. It was on me. There are multiple people whom I am taking risk on. I'm responsible for. It does cause a lot of pressure on me too, because God forbid something goes wrong, you can always turn around and tell me, you told me not to go to the hospital.
Yes, sir.
But I am doing what I think is the right thing to do. I feel it is the right thing to do. That is the reason I'm doing it. And I'm standing by. So I'm spending a lot of my time and energy on people with COVID, trying to prevent them from taking too many medications or getting themselves admitted. But my team is doing a fantastic job. They have been a pillar of strength. They have been
exactly.
Yeah, they've been.
Thank you, doctor.
They've been taken.
Thank you, doctor.
I guess
I wish more and more people can come to know about this, doctor.
I'm sure they will. So this was just one of the first time I tried it out. I would like to do more and more of these Zoom calls in future.
சொல்றாரு ரொம்ப பேஷன்ஸ் இருக்காங்க. So he goes through everybody's
Do
case.
more and more Zoom calls in future
He gives
so that we
preference
can
to
address
the patients
more
because
number of people
sometimes
also.
he tells them not to go to hospital. So when he gets emergency calls and all that, he has to attend to them. But he goes through, trust me when I say that, I go to every patient and prescribe the medicine. And my team takes care, very good care. You can trust them. He said. If they have doubts, they keep asking me.
Yeah, I didn't really hear that much. Sorry. So I think it's time to say goodbye. Anything, any
Yeah.
other question?
Dr. Manoj, how should we go for this steaming and the gargling? Because of late, too much of stress is going on.
Anything, Sanjita, anything that doesn't cause harm. Anything that doesn't
Okay.
cause harm. Kara, gargling, steaming, go come
Okay.
in, stand in the sun. Stand in the sun. That's also very good. I mean, morning sun or evening sun, that's also very good. Do
Okay.
anything that doesn't cause harm. Nothing wrong in it.
Achha. Take. Thank you so much.
So thank you everybody for joining at a short notice. I do want to cause, I will be doing more of these Zoom calls. Telling you, please subscribe to the YouTube thing and the Insta so that you kept updated about my thing. I will also update you about the COVID trials that are coming up and uh, about the how the results are and stuff like that. It's been a pleasure, and it's wonderful seeing you all after a long time. I really miss you all. I truly miss you all. After 32 years of seeing all of you, I truly miss being in touch with you. And I feel very sad when I see people with masks on because I cannot communicate with somebody with a mask on. I find it very difficult to talk to somebody with a mask on. I hope a time comes when we can be mask free and then you can look at each other's face and then talk, understand the expression and talk.
We can come back to the clinic.
I'm sure it will. I'm sure it will. I'm sure it will. I will all meet again.
And Dr. Manoj, please have this type of session very regularly.
I will. I will. I'll definitely have.
It will help us and mostly all of
I
the
think
people.
it'll also help if you can leave your comments, at the end of it.
Paka.
As
Yeah,
to
yeah.
how you guys liked it, so that we can
Sure.
have more such sessions also. It would be nice to, particularly those who didn't interact. It would be nice to hear from them in terms of a comment, so that it'll be useful. So thank you so much.
Thank you,
It's
doctor.
been an absolute pleasure.
Thank you so
Thank you.
much.
Thank you, doctor.
Thank you. Thank you.
Happy minute.